Welcome back to Whiteboard Wednesday. It's Dr. Edwards at Sarasota Vascular. Today we're going to talk about aortic dissection. I don't know about most vascular surgeons out there, but I think this is probably one of the most complex topics that we are continuing to actively debate. Think about a blood vessel as kind of like a garden hose. So if you cut a garden hose and you're looking straight down the pipe, okay, you've got layers. And the aorta is the same way. So you have an innermost layer, a medial layer, and then the outermost layer. A dissection happens when you get a tear right in this innermost layer. And what happens then is you have blood flow that's flowing within the true part of the aorta, and you also have blood flow that's getting trapped in the false part of the aorta, what we call the false lumen. Essentially, there's blood flowing into the wall and then it gets stuck there. The trouble here is that this tear doesn't necessarily stop right away. That tear can travel all the way down the aorta, and there's other important branches that can get affected. It essentially renders the wall weaker. And so dissections can then start to turn into an aneurysm. Well, so what do we do about this? It sounds really scary. Most of the time, if a dissection is involving the descending part of the aorta, a lot of times we treat it medically. And by that, I mean, we want to get the blood pressure down. We want to keep the heart rate down. We want to decrease the pressure that's coming around this aortic arch. We want to decrease what we call shear stress. So this is how much force is coming around that arch that might cause this dissection to tear further. It really depends on which part of the aorta is involved. Now, I haven't talked at all about the ascending aorta because that is really, it's treated quite differently. Actually, it's a surgical emergency and it requires open heart surgery with a team of cardiac surgeons. So we're talking really about the descending aorta. So let's say we have a descending aortic dissection, what we call a type B dissection. We get follow-up imaging and the aorta's gotten a little bit bigger, or the dissection looks like it's spread. So what do? Well, the way we treat this, almost always, okay, is with a stent. And that stent basically covers up the damaged part of the aorta. Sometimes those dissections can be very close to other critical branches, such as the subclavian artery that supplies the blood to the left arm. So what we'll do is we'll place a special stent that has a branch in it. We need to restore blood flow to the important branches, and we need to cover up that damaged part of the aorta, because what we want to see over time is that rather than that aorta that's by definition a little bit weaker, rather than getting bigger, that aorta is remodeling nicely and healing down around that stent. Signs and symptoms: severe chest and back pain between the shoulder blades. Go to the hospital, get checked. You never know, okay? There's no harm. If it is something that's happening, you want to know early, because sometimes early intervention is really important. Thanks again for tuning into Whiteboard Wednesday. Dr. Edwards at Sarasota Vascular. This was our lesson on aortic dissections. Thank you.